This presentation discusses the unresolved problems associated with cataracts, one of the most common diseases in the world, its early diagnosis, and the possibility of non-surgical cure. A cataract is a clouding of the eye lens, caused by increased scattering and absorption of light. Most cataracts are age-related, and 1 in 2 people over 80 in developed countries have had or are awaiting cataract surgery. Preventive cataract therapy cannot be efficient without its early diagnostics. If treatment starts at the earliest stage of cataractogenesis, while the structural changes in the eye lens are still reversible, there is a great chance of success. The primary function of the lens is to focus light onto the retina. The lens consists of an ordered arrangement of differentiated fiber cells, that have lost cell organelles and nucleus. This makes protein turnover impossible, and once synthesized proteins remain in the lens for life. To maintain metabolism, these cells are interconnected by so-called gap junctions, which ensure the circulation of ions and antioxidants and the removal of waste products. The high refractive index of the lens, 1.38 in the cortex and 1.41 in the nucleus, is due to a very high concentration of protein increasing from 200 to 400 mg per milliliter towards the nucleus. Despite the high concentration, proteins remain soluble, providing high homogeneity to the refractive index. However, modification of the protein may lead to precipitation, resulting in an increase in light scattering. Since one crystalline protein contains an average of 4 tryptophan residues that absorb UV light, the lens has an extremely high optical density in the UVB range, forming a long-pass filter which protects the eye and the lens itself from toxic UV radiation. The young lens is transparent in the visible range up to the near UV. However, over time, absorption in the visible spectral range builds up. We and others showed that this absorption results from the formation of post-translational modifications in the lens proteins. This figure shows the absorption spectra of the most abundant fluorescence post-translational modifications with absorption spectra in the visible range. Notably, many of these post-translational modifications are the result of photooxidation of the tryptophan side chain. This is, however, a rather paradoxical finding, since tryptophan cannot be excited in the lens by UV light due to the long-pass filter caused by its absorption. Therefore, the question arises of how these tryptophan photoadducts are formed. To answer this question, we need to take a closer look at tryptophan spectroscopy. We have demonstrated earlier that tryptophan's side chain is a polar dimolecule and its electronic spectra depend on the solvent polarity. The figure shows the excitation and emission spectra of the same dye dissolved in low, medium, and high polarity solvents. The higher the polarity, the redder is the wavelength of the spectral band. The spectral shift of tryptophan emission between a nonpolar solvent, such as cyclohexane, and highly polar solvent, such as water, is about 42 nanometers, which is comparable with the half-width of the spectral band. An emission spectrum of a multi-tryptophan protein is a superposition of the spectra of its individual tryptophan residues, which are located in different polarity environments. If the side chain is buried in the protein body, where polarity varies from low to medium, the absorption spectrum has a maximum at 280 nanometers and there is no absorption beyond 310 nanometers. But if a side chain is on the surface of the protein, and therefore is exposed to the aqueous environment, the absorption spectrum shifts to red, and this fraction can be excited selectively in the 310 to 320 nanometers range. This water-exposed red fraction is highly susceptible to oxidation by reactive oxygen species. Therefore, we suggested that it is this fraction that can be responsible for triggering the process of photooxidation in the lens, since it can be excited by UV light inside the lens and possesses an increased reactivity. Being seemingly a small breach in a well-organized UV defense mechanism, it causes irreparable damage to the metabolism, opening wide the gate for massive oxidation of proteins by visible light. In addition, some photoproducts, such as N-formylquinurinin, are powerful generators of singlet oxygen, which further exacerbate the situation. Concentrations of fluorescent photoproducts can be semi-quantitatively determined from decomposition of the emission spectrum of the eye lens. We found that the total concentration of the first three of them correlated well with the grade of cataract. The concentration of fluorescent post-translational modifications can be measured at micron resolution across the lens using hyperspectral confocal fluorescence microscopy. In addition to sensitive and accurate diagnosis of cataracts, this technique with the use of extracted pig's lenses can be employed to identify and profile chemical compounds that have the potential to cure cataracts. Using this novel ex vivo drug research platform, we will be able to study the diffusion of chemical compounds in the lens and their retention time, as well as the effect they have on the lens structure. Our main goal is to identify chemicals that can effectively slow down the photochemical process by enhancing the natural mechanisms that ensure the metabolism of the eye lens. We will also profile chemicals that can presumably disaggregate protein precipitates caused by post-translational modifications. The drugs identified in this study could be used in the preventing treatment of cataracts to prolong the lifespan of the eye lens so that the patients can live their entire life with their own eye lenses.